In this video, I discuss autistic health and the health of the non-autistic members of autistic people's families. This is an important area for advocacy because health problems often get ignored. They get gaslighted, or they get inappropriately treated because people don't understand them very well or oversimplify them. I'm not going to run through the comprehensive list of all of the vulnerabilities that autistic people and their relatives may have. I'm going to just touch on a few so that you can get an idea of how broad this scope is and how much there is to learn, and just how vigilant we really should be about health issues. A good analogy that's raised by one specific autism scientist, Martha Herbert, is that autistic people are like canaries in a mine. So we tend to be more sensitive to environmental problems. Now, canaries in a mine, what that means is that in the olden days, if people wanted to see if there was gas in a mine, because they couldn't always smell it, and by the time that there was gas that could kill the miners, and I think it's in coal mines, then it's too late to get out of that mine, and the miners all pass out. So they would take little canaries in cages in, and then when your canary in the cage passes out, then you say, oh my goodness, there must be gas, so let's get out of the mine, it's not safe here anymore. Autistic people are like that. If we have bad environmental factors, if there's pollution, if people are eating poor diets, the autistic people are often the ones who are going to get affected first, and they're going to show you, we should be dealing with our environment. That's just one useful way of looking at things. We also need to note, and this is why my definition of autism is quite a neutral one, that some things are disorders in one context and they have a good side in another context. So I prefer not to look at autism as either a gift or as a disorder. We'll just talk about a phenomenon, and then we need to optimize health. In other words, make it work as well as possible. We need to anyway optimize autism and say, this is a fact. We are people who are like this, and deal with it. Let's make the best of what we are in this world, not from the perspective of, oh my goodness, let's make the best of a bad job, but actually let's deal with the fact that we have disabled citizens in our environment. 10% of the world's people are disabled in some form or other. It's the world's largest minority. Okay, we'll deal with that when we get to human rights issues. Let's focus back on health though. So here are some of the things which occur in autistic people that we need to take note of. Systemic inflammation would be one of them. There are often joint hypermobility disorders, and this will be in autistic people and their families. There are sensory issues which can be optimized and can maybe made to work better. So on the one hand, we might find a type of person who has severe joint pain, who has lots of headaches, bad sleep problems, but is hugely creative and very intelligent. So there are flip sides to these things. That's why we talk about a phenomenon rather than about a gift or a disorder per se. But we want those things which cause us harm to be treated. I'm going to go through a list of some of the things that are underdiagnosed and misunderstood in autistic people, and they're certainly not the only ones. They're just isolated examples, perhaps fairly prevalent though. One of these conditions is joint hypermobility disorders, and in fact that is perhaps a bad term for them. I should perhaps be saying connective tissue disorders. When we're talking about connective tissue disorders, some of the names there would be things like Marfan syndrome, but particularly the Ehlers-Danlos syndromes. These connective tissue disorders, because our connective tissue also houses our mast cells and it has quite an effect on our immune system, leads to systemic diseases in some people. So symptoms that we might see on the outside would be things like being able to put your finger down like this. Watch this, I see, do that, okay? They turn upwards, knees knocking backwards, severe headaches, brain stem starting to slip down into the brain, into the spine and becoming impinged. That's called a Chiari type 2 malformation. It can lead to garbled speech or funny speech or even a loss of speech. It certainly leads to severe headaches. It leads to balance problems. It leads to projectile vomiting. And if you get some kind of inflammation there. Due to this happening, you can die. The thing can burst. So I'm just going into some of those extremes, but that will also go together with gastrointestinal problems. It particularly affects women, possibly because having slightly less, muscle strength, keeping themselves together is harder than with the men who are affected by this. But it's not to say that men are not really, really badly affected as well. So why is it important to understand a condition like that? Well, many people who have these conditions say the thing that they had wanted most as a child was that somebody would just believe them that they are in that amount of pain, because the pain is constant eventually. You might end up in a wheelchair, so you're sitting more comfortably, supposedly, but you're constantly in pain. One autistic woman who has children described the level of pain that she experiences. She said unmedicated childbirth, she would put on about a level 5 for pain. Now, the pain that she's constantly in with painkillers, with prescription painkillers, is a level 6. Every single day of her life, as she has to work, as she has to do housework, as she works with her children, that's the level of pain she's in. So what frequently happens to young children is, I don't want to walk around the field, I don't want to do gym, no, my legs are sore. And what does the parent say? Oh, growing pains, don't be so fussy, don't be so silly, come on, everybody can walk around the field, what's your problem? It's pain, it's pain, it's pain. Being believed is incredibly important. What Ehlers-Danlos patients go through to get a diagnosis, to get believed, to get to not hear from doctors, oh, you're making it up, you have a psychiatric diagnosis, and so therefore this is somaticizing. You're pushing your psychiatric symptoms and your stress all into imagining that it's part of your body. But don't worry, your body is actually fine. No, your body is not fine. Your body is sick. And very often it'll take decades before somebody is finally diagnosed, if at all, by which time they are seriously, seriously ill. So it gives you an idea of the extent of the problem. Let's take a look at another condition, completely different from this. Sometimes a child who's autistic will appear to regress overnight. Suddenly they were fine the one day, and then the very next day they're suddenly obsessive about everything, scared of everything, have huge sensory problems, scream, have fears, and so on. And people put this down to, oh my goodness, the autism's, they's got bad. No. I've seen people take their kid off to the doctor, and immediately the doctor wants to prescribe Risperdal, a drug which was, the makers of Risperdal got a fine, I think it was in 2012, 2013, for pushing this into autistic children. It's a hectic drug. I've been on this thing myself. I'd perhaps take it again for maybe 2 weeks, and then not longer than that. It does a huge amount of damage. Okay, so, and they get put on Ritalin, they get put on all these things, doesn't work. What is the problem there? Well, I've done a number of referrals of children who have had this condition and said, please, please, as soon as possible, as soon as this happens, go and get them a streptococcus test, because it looks like a condition called PANDAS. Now, let me just see whether I can actually tell you what PANDAS is, if I can remember all this in my head. Pediatric, P. A, autoimmune. N, neuropsychiatric. D, disorder, I think, or disease. A, associated with streptococcus. Well, there's something called PANS as well, P-A-N-S, which is similar but not caused by streptococcus. So if this happens in an autistic child, and an already autistic child, then the tendency for untrained physicians is to say, oh, it's the autisms, so we've got to treat the autism. They get sent for behavioral therapy, my goodness. What do they actually have? They have an autoimmune condition which is being caused by a bug, a bacterium. And you want to give them behavior therapy when they're sick. So this does not only affect autistic children. Some children get a misdiagnosis of autism because they have something like PANS or PANDAS. So we have to be really careful about putting everything down to the autisms. What else is there? Okay, sensory issues. A few years ago, I made quite a long video when I first started learning about what causes, for example, hypersensitivity in autistic people, sensory overload, as we call it. Many of us have dysregulated electrolytes. Many of us are deficient in things like basic things like magnesium, potassium, calcium, sodium, and we particularly, according to some scientists, have dysregulated calcium. But because these things all act together with each other, it's a complex system. So if the one thing goes wonky, then it has a cascade knock-on effect to a whole bunch of other things. Right. Okay, how does sensory overstimulation work? From what we can tell at the moment, the current hypothesis, and this was developed by an autistic woman, Benjin Gerber, and it has translated into treatment, which has certainly helped a lot of us, myself included. Namely, many of us have ion channel diseases. What are ion channels? They are the little protein channels where electrolytes go in and out of the cell. And there are other electrolytes in some cases which gate them, in other words, which act as the key to open and close those channels. Okay, so as a result of genetic anomalies, we may have our genes giving instructions to make those protein channels, and then the instructions come out suboptimal. They're not the best. And that means that the electrolytes are not regulated very nicely. And we get all sorts of conditions from ion channel diseases, well, outside autistic people as well. Epilepsy, which is also affects a lot of autistic people, can be related to ion channels. There are heart conditions. There are periodic paralyses, which are related to ion channels as well. And some of these also occur in autistic people. Sensory overload then, from what we can tell, usually happens when there is a wonky ion channel, usually a calcium channel, which causes us to not retain enough intracellular magnesium. And because there's not enough magnesium there to gate the potassium channels, so we start losing potassium, and then we end up with too little potassium inside our cells. That's one of the mechanisms. It's not the only possible mechanism. The result is that what do we need to treat this lot? Because we've got a broken, more wonky ion channel. Well, if we want to just start by treating the actual symptom, then ideally what we need to do is we need to get magnesium back inside the cell so that it will do a better gatekeeping or gating. And we also need to supplement with potassium because we're not going to be able to get enough from our food given the rate at which we're losing potassium. Why that's sometimes difficult for people to see is because if you just go to a lab and the doctor sends your blood off to a lab, has a tested general electrolyte count, if you are low in potassium, it's not necessarily going to show up there. There are so many different tests which one can do to show potassium, which are not accurate and which do not actually accurately reflect how low your potassium actually could be inside your body. We also have another kind of sensory overstimulation, which is when you actually are sensitive to too much potassium. But for many, and what seems to be for most of us, what works is the supplementation of potassium, sometimes with a bit of taurine, because it helps with calcium homeostasis, and then also to ensure that, what did I say? Magnesium. I should say magnesium first, okay, a bit of taurine, and also potassium to start restoring that balance. And this has to be done with care, preferably under the auspices of a physician, so that you don't overdose yourself. But with many doctors not being aware of it, there's a lot of training that needs to be done in that area. So that gives us 3 of the areas relating to health, and those are just 3. Now, why are these important in terms of traditional autism training? As an autism professional, somebody working in the autism industry, perhaps you're working speech and language and you see this child has severe behavioral problems. And then you think, well, this is not my area of expertise. Let me refer this person to a therapist who deals with behavior. Perhaps you might choose something like an applied behavioral analyst or technician, who repetitively will help a child to change their behavior by repeated rewards and withholding of rewards. This is highly problematic. This does not address the problem at all. Would you, if somebody was walking with a limp and you wanted them to walk normally, you send them to a behavior therapist to rectify their behavior because they are walking badly? That's not how we deal with disability. If somebody cannot see what they have to read, you send them to a behavior therapist. No, this is not the nature of that disability. So what these therapists usually do is they think that we must do desensitization. Desensitization essentially means expose the kid to the problem situation, the bright light, the noise in the background, and reward them for when they can sit and cope with it. Okay, so rewarding me if I sit and cope with pain and distress is good for me. How does that help me to be honest about anything in my life? Because if I'm honest and I say that I'm in distress, or if I show the distress, it only gets punished or ignored. It doesn't work. Treat the problem or accept that somebody is that way. One or the other or both. But don't try to reward behavior which does not match the endophenotype that you're dealing with. So I think that gives us a glimpse into some of the issues with autistic health. Many mothers of autistic children, especially, regardless of whether they have a diagnosis of autism themselves, experience sensory problems too, over and under stimulation and so on. Many experience joint pain. Many experience a lot of the other inflammatory conditions which affect autistic people as well. So if we're taking a look at autism from a medical perspective, as a medical condition, it might not be the best way to actually frame it. We should not be doing research into trying to cure autism. We should be doing research into trying to deal with the health conditions that affect autistic people and their families and their non-autistic relatives. That would be a much more useful thing to do.